Iowa continues to see rising cases of RSV across the state, and the state's educators are taking notice. Local 5's Nora J.S. Reichart tells us what's being done to keep students healthy.
Parents of students at Bergman Academy received an unexpected email in their inboxes on Monday night. The school wanted to inform families that more and more students were falling ill, and if that trend got worse, a temporary closure wasn't out of the question.
We sent the email letting them know, number one, this is what we're seeing. We have had diagnosed cases of influenza. We have seen RSV. There's always a virus here and there that pops up during this time of year.
But it's certainly not a problem that's unique to Bergman. According to the latest data from the Iowa Department of Public Health, 39 schools across the entire state are reporting that 10% or more of their student body is currently out sick.
And many of those sick kids end up needing some serious medical attention. Blank Children's Hospital in Des Moines has been seeing an unusually high surge in RSV and influenza cases. And the reason why has to do with kids' immune systems simply not being ready to deal with these seasonal illnesses.
With COVID, we isolated, we didn't go places for a couple of years. So we have a couple years worth of kids that really haven't been exposed to as many of the respiratory viruses.
In order to help keep their issue from reaching that level, Bergman is starting additional cleaning measures such as extra sanitizing rounds after classes end and using air purifiers. If some of these sound familiar, they probably should. A lot of them are the same protocols that the school used when COVID was at its peak.
I think what really matters is that we're keeping our kids safe and healthy. And when they're safe and healthy, they can learn better.
In Des Moines, this is Nora J.S. Reichart for Local 5 News. We are Iowa.
Dr. Anderson Sudeth says that while most RSV cases can be dealt with like a bad cold, there are a few signs parents should look out for in case a child needs emergency care. The biggest ones being unable to drink or having severe difficulty with breathing.